Back to Canada here. Well, Canadian hospital emergency rooms are said to be understaffed and they're facing a huge number of patients. And across Canada, essentially health authorities have cut the hours of hospital emergency departments. Can you imagine? As urgent care clinics have also done the same in recent weeks. And they're saying that this may extend through the summer, and this is due to the surge of patients and staff shortages. So the worst case scenario, having staff shortages and having a surge of patients all at once. And the situation they're saying is tied to essentially what, dealing with COVID-19 and the backlogs that were created in the hospitals and when it comes to clinics around the country. And they're saying it's clogged up the hospitals when it comes to hallway healthcare, which we've heard so much about in provincial elections as well as federal elections. And this is, and they've talked about when it comes to some of the doctors and nurses, about hospitals and clinics, waiting rooms being overflowed and long hours in waiting for inpatient care, and occupancy rates are almost 100% when it comes to the Children's Hospital. There is a backlog for operations and surgeries for children as well due to the pandemic, which a lot of them have been postponed. And now it's a funding issue, as what some of the healthcare providers are saying. So essentially, you would essentially expect that when it comes to small towns, this would be an issue, but this is happening in big cities across Canada, and it's also happening in regional health hubs too. So this is quite shocking that this might continue throughout the summer. We're dealing with a lot when it comes to inflation in the country. We're dealing with the cancellations of flights and airport disasters when it comes to traveling, getting through security, customs. They're having staff shortages. We're talking about the passport wait line with people sleeping overnight outside of Service Canada, and they're saying that might take throughout the summer months as well. And now we're talking about when it comes to healthcare. So something needs to be done about this, and Ontario Health Ministry says that they didn't actually confirm how many hospitals in the province are going through this that have partially cut their hours or had temporary closures, which is a scary situation to even fathom. When it comes to hospitals in Quebec, it's the country's second largest province, as well as New Brunswick and Manitoba. They have partially shut departments and cut their hours when it comes to like a couple of weeks ago, when it comes to the shortages that they're dealing with. And in Kingston, Ontario, the Hotel du Hospital Urgent Care Clinic reduced its hours over the Canada Day long weekend. So if you needed urgent care, well, that's the situation. Some of this stuff has began on Friday, and when it comes to Kingston Health Science Center, they said that this is due to their staff shortages and the surge in patient volumes, and they're saying they just can't deal with it. And they're saying because of the staff shortage, this is something that they're going to deal with throughout the summer. We did have a provincial election that election day was on June 2nd, which elected the PC government for its second mandate with a supermajority. But if you recall, the election platform, when it was debates and what all the other parties were talking about, was hiring more nurses, more doctors, and that's something that's needed. And now we're seeing what that actually means when they cut hours. And when it comes to children, well, they've been hit the hardest when it comes to healthcare services. And this is something that the Children's Hospital of Eastern Ontario in Ottawa has said that about, they ran between 110%, 120% capacity for weeks in May and early June. And they're saying their occupancy was at a record high for the month of May, according to their spokesperson. When it comes to funding, well, they're saying Canada has the fourth lowest number of funded acute care beds per capita among countries in the Organization for Economic Cooperation and Development, according to OECD. And when it comes to the Commonwealth Fund, well, Canada Health System ranks in second last among 11 rich countries. So we're not doing so well in those rankings. And some blame that the healthcare system debacle that we're dealing with dates back to the 1990s, when the federal government decided to cut spending to get the country's deficit under control. We do have deficit spending now, but we do have this need. Now, when it comes to Fraser Institute, well, they have put out reports saying that potentially some way to deal with this is by, going towards potentially a privately paid model. So that's something that we're hearing about when it comes to the Conservative leadership election, which now has 6 candidates, and will choose a leader on September 10th. And part of the debates have been potentially having a public-private healthcare system to deal with some of this backlogs, what this means in terms of who is elected in the Conservative leadership and what it means for a general election. Well, that's to be seen, but you can make sure that we're going to cover that on Y Media, Political Sensex, and you want to stay tuned for that.